My name is Bianca Potenta. I'm a practicing naturopath, business coach, and clinic mentor, and this clip has been created to help guide you through the essential things that you need to think about once you've graduated. There are many essential things that need to be organised once you've graduated, including your TGA number, provider numbers, association memberships, and insurances. But if you haven't organised any of this before, it can be a little bit confusing as to where to start. The first step is to become a registered member of an association. It's a good idea to register with an association even if you don't plan to practice straight away. The entire process can take a lot longer than expected, in some instances up to 12 weeks or longer. Also, one of the requirements as a member of an association is to continue your professional education. This ensures your qualification remains up to date, which might be necessary in instances of applying for a job. But the big question is, which association should you choose? My advice is to choose an association that aligns with how you would like your industry and you as a practitioner to be represented to the wider community. Think about the association's stance on hot topics like registration and patients being able to claim their private health insurance on consultations with you. Other things to consider when comparing associations is the level of ongoing support they offer, if they provide you with access to different types of health journals and research databases, and the cost of their yearly membership fee. Whilst you are still deciding which association you might like to join, it's best that you start to organise your paperwork for your submission, as each association's application process is very similar. You will need to organise copies of your academic transcript, qualifications, and senior first aid certificate. Some associations will also ask for a passport-sized photo, and you will need to download and complete the association's application for membership form, which can be located on the association's website. It's important to note that all documents need to be certified by a Justice of the Peace, and there may be other documents needed to complete your application. For more information, it's best to visit the association's website or to give them a call. Once your association has confirmed your membership, they will then begin to organise your insurances, provider numbers, and TGA number. It is required that members of associations have professional indemnity and public liability insurance to cover legal responsibilities when practicing and seeing patients. It is important to note that the required level of cover for professional indemnity insurance may vary depending on the modality. It is best to speak to your association to find out the exact amount needed to ensure you are covered appropriately. Provider numbers enable your patients to be able to claim a portion of their consultation fee via private health. The process to register for provider numbers may take 4 to 8 weeks. Once a month, professional associations send a list of member registrations to a private health insurer. After the health funds have processed these registrations, an email will be sent to your association confirming your registration. Your association will then forward your provider numbers to you. It is important to note that you do not have to have a health fund provider number in order to start practicing. You can start practicing after becoming a member of a professional association prior to receiving your health fund provider numbers. However, your patients will not be able to claim a portion of the consultation fee against their private health until you are a registered provider with a health fund that your patient is a member of. The amount rebated against consultations from private health does depend on the level of cover and the health fund that your patient is with. It's always best to advise your patient to speak to their health fund for more information. Please be aware that there may be some health providers that you'll need to register with yourself. To find out more, it's best to speak to your association. Also, keep in mind that provider numbers are specific to a location. So if you are practicing at 2 locations, you will need to organise a provider number for the same private health insurer for each location. Along with your insurances and provider numbers, your association will also organise your Therapeutics Good Act number. You will need a TGA number when applying to open an account with suppliers of practitioner-only products. For more information, follow the Natural Business Tools Facebook page and be kept up to date with various tips, tools, and webinars, all designed to support students transitioning to become a successful natural healthcare practitioner.